So today we're going to be doing a bed bath on our patient. This is Miss Chloe Simple. I just want to make sure that she's the correct patient. So I check her wristbands. You can also look at her chart, or you can ask for her name if she's able to give you the name. I already washed my hands and put gloves on, so we're going to get started. So I'm going to fill the basin with water up to there. It's got to be lukewarm, not too hot, not too cold. I want to test it on my arm, make sure it's not too cold or hot for the patient.
We're going to be doing this bathing today.
Right. So I'm going to start with her forehead. Put the bed up first into a comfortable position. And we're going to put this side's guardrail down. I'm here to be able to catch her if she were to roll over. Always leave that one up just for the patient's safety. All right, so we start with the forehead. And then I'm going to clean her eyes from the inner cannula out. Get a different position of the towel so you don't get anything from the first eye in there. Wash the rest of her face. And you want to make sure you pat the face down. You don't want it to be wet after, because they could get a little cold. All right, and we're going to move on to her arms. So I'm going to use a clean towel to cover her up.
Let's just did you see this other video that I sent the one that I
Did you receive that?
Right. And we're going to wipe the arms top to bottom.
really then I turned it around.
And you want to make sure you get in between the fingers on the hands.
That's the only way I would say
I don't use the burger.
Dry her off.
but you should be able to receive the stuff from there, right?
I never log into my burger email. I never use it.
And we're going to do the other arm same way, top to bottom.
This one, this is the only one that I have. That's it.
In between the fingers again.
Yeah, I never got this. You never emailed it to me. Do not use my burger
Dry
email.
her off.
I really know.
I'm gonna use my Virgin email and I'm gonna send it to you through my Virgin email so you can
Yes.
And then we're going to move on to her chest.
well, what can we do? Nice. I thought I sent it. But I mean, we still have time, right? Send it to like the required.
And onto her stomach.
I'm just making sure. Like, are you sure you don't want to?
Dry her off again. And we're going to move on to the peritoneal area, but you want to make sure to change out the water. Same height, same temperature, test it on your arm. And we're going to wipe from front to back.
What's your full name? What's your date of birth? Okay. And then I'm going to look at my chart and make sure it.
And we're going to change out the water again before we move on to the leg. Same thing, temperature, test the
I
arm.
want to make sure that I get it.
And I'm going to grab a clean towel as well. And we're going to do the legs. And again, same thing, top to bottom. And you can dry in the opposite direction to promote circulation of the legs.
And I'm going to make my patient.
And I'm going to flip her over or I'm gonna change the gown quickly.
See, that's it, because I want to start with oral.
All right, so I want to do her back and the back of her leg, so I'm going to flip her over. Rachel's going to help me. And we're going to go top to bottom again. Dry off the back. And then we're going to change out the water before we get to the gluteal area. Front to back.
Water is good. And there's going to be one for clean water and one with, we're going to put the soap in.
Change out the water again before we do the back of the legs. Grab a clean towel.
I'm going to take my towel.
And we're going to dry the legs off. And while she's rolled over, you kind of want to look for any areas where there could be pressure ulcers forming, any redness or deterioration of the skin. And we are going to do her feet. You can get in between the toes. And again, you can look for pressure ulcers on any of the bony prominences on the feet, ankles, anything like that.
Oh no, actually my bad. I was supposed to start with the forehead.
In between the toes. And we're going to dry her off again.
Okay, Mrs. Jones, are you able to do it yourself? Can you wash yourself?
All right, and we can roll her back over. She's all set. All right, and I'm going to put this up and I'm going to grab new gloves so I can do some oral care on her. All right. So for oral care, you want to use one of these and you want to get all the areas of the mouth, against the cheeks, the teeth, under the tongue, on top of the tongue. And while you're doing it, you kind of want to assess the mouth and look for anything that could potentially be wrong or cause any problems for the patient. All right, so we're just going to go in.
Oh, that's right.
But then you just have a bowl of dirty water.
Yeah, you have to change.
All right. She is all set, so before you leave, you want to put the guardrail up and the bed in the lowest position. And we're going to cover her back up.